opinion on the healthcare system is that it's probably one of the best systems in the world. However, between governmental intrusion and attorneys getting between the patient and the doctor, and basically talking patients into having higher expectations than reality would serve, there are many things that end up not going right in the system currently. It used to be doctors were willing to come to your house if you couldn't make it out. They can't do that anymore. They can't afford their time because you have such a demand on it. And in many cases, you have people now proposing plans that basically would make the doctors, physicians, assistants, and nurses all slaves to everybody else. So as a consequence, they're essentially attempting to steal their time and services by mandating that they provide services at a loss or at a very severe cost. People gripe because doctors allegedly take in so much money. Well, the challenge there is that by the time they pay their rent, their malpractice insurance, all the people that work for them, they may take in $1 million a year, but in pocket, maybe $50,000. And this is after someone who's spent 12 years in high school, 4 years in undergrad, and about 6 years between graduate school and internship before they even get their license to practice. And $50,000 a year for that much time and effort having been put into a profession isn't much of a return. Attorneys, go to graduate school, get their Juris Doctor or their Doctor of Law of Letters, and they go into practice and they charge $100, $200, $300, $400, $500 an hour for their time, and they have nowhere near the investment that the doctors do. Yet the attorneys are willing to do Monday morning quarterbacking and require a 100% accuracy at all times, whereas if an attorney messes up, the attorney's response is, well, we're all human. Unless you're someone that the attorney is suing, then you have to be superhuman, or you have to be God, and there's a problem with that. And all of that has a cost in society. There are some doctors where their annual malpractice premiums is almost $300,000 a year. And where does that go? That goes into the people who provide malpractice insurance, read attorneys. So that's why, in many cases, my belief is it would not hurt to get attorneys out of a lot of things that they're in right now. Yes, there are a lot of very fine attorneys. Unfortunately, there are a very large number of attorneys that are not so fine. And therein lies my issue with that. As far as my experiences in the healthcare system, I'm a retiree, and so far I've had very good experiences as far as coverage and so on. But then I also do my own research, look and think about stuff, which unfortunately many people do not, and they believe what everybody tells them. And that doesn't always work well.